Bismillahirrahmanirrahim. I'm Dr. Naveed. I'm a consultant neurologist, Allied Hospital, Faisalabad. Here I'm going to discuss with you people the brain tumors. Incidence of brain tumors is 8 to 25 per 100,000 population. Etiology of brain tumors is very vast. For example, there are a few genetic tumors like von Recklinghausen or tuberous sclerosis could lead to tumors in the brain. Viral infections, previous infection with Epstein-Barr virus could lead to primary brain lymphoma. And then multiple environmental factors like pesticides, chemicals, or radiations could lead to brain tumors. The classification of brain tumors, there is a long list of this classification, but we will discuss the common ones of these. Neuroepithelial tumors like astrocytoma, oligodendroglial tumors, and ependymal tumors like ependymoma. Then I will show you choroid plexus papilloma and meduloblastoma. Tumors of the sellar region are also important. That could be Pichotti adenoma is the most common one. And then metastatic tumors to the brain, and then we will discuss other types of tumors. The secondary tumors can originate from lungs, skin, kidney, breast, and colon, and then could spread to the brain via bloodstream and can cause secondary or metastatic tumors of the brain. Secondary brain tumors are 25% of all of the brain tumors are secondary in nature. So the overall features of brain tumors, here we will discuss them. For example, the signs and symptoms are due to raised intracranial pressure. Could be headache, vomiting. On fundoscopy, we can have papilledema, dilatation of the pupil due to the third nerve palsy. Then patients can present with epilepsy. Epilepsy could be of focal or generalized type. Altered state of consciousness, varying from somnolence, increased sleep, or to frank coma. Psychological or behavioral changes is a common presentation of brain tumors. And then the focal signs, depending on the localization of the tumor. For example, if there is a tumor on the right motor cortex of the brain, there will be weakness of the left side of the body. This is an example of focal signs due to the brain tumor. Now the common tumors, astrocytoma. WHO classifies astrocytoma into 4 grades. Grade 1 and 2 are benign. Grade 3 is called Paraneoplastic astrocytoma. Grade 4 is called Glioblastoma multiforme. It's a common tumor of adults and it commonly localizes to the frontal and the temporal lobes. It's very rarely seen in childhood. This is MRI of the brain showing astrocytoma. This is an MRI brain with contrast showing contrast enhancement. This is MRI brain plain. This is MRI brain with contrast. There is a tumor and then there is a surrounding edema. On contrast, there is a dense enhancement of this surrounding lesion. Glioblastoma multiforme is the most malignant tumor of the CNS. It rapidly progresses and leading to death, occurs in 5 to 6 decades, commonly seen in men. It affects deep parts of the brain like basal ganglia, thalamus, and white matter. The differentiating features on CT scan is its cystic or necrotic or hemorrhagic component of the tumor. This is MRI brain T1 and T2. T2 shows multiple. This is the tumor on T1 showing mixed density lesion, and on T2 the tumor is hyper intense and with the central necrotic components are seen here. This is CT brain of glioblastoma multiforme, and this is MRI contrast of the same patient showing dense contrast enhancement of the lesion. Here is also contrast enhancing lesion of glioblastoma multiforme. Oligodendroglial tumors occurs in adults. The differentiating feature of oligodendroglial tumors is its calcifications, commonly seen in the frontal lobe. Ependymal tumors are also seen in adults that occur within the ependyma. For example, ependymoma. They will lead to obstructive hydrocephalus. Here is MRI brain of a patient showing ependymoma within the fourth ventricle. Then choroid plexus papilloma is a rare tumor, commonly is rare but seen in children, rare in adults. It also presents with hydrocephalus. This is an example of choroid plexus papilloma of the fourth ventricle. And then neuroectodermal tumors like Meduloblastoma. It is frequently seen in children. It affects the medulla, so it involves the brainstem. Brainstem is controlling our respiration, our heart rate. So it's very high grade. It has a high grade of malignancy, rapidly progresses. It could metastasize to other parts of the brain, other parts of the body as well. This is an example of Meduloblastoma. Then meningioma. 30% of all brain tumors are meningioma. They are localized to the hemispheric convexities, parasagittal, olfactory groove meningioma. They are seen in sellar trachea, then pontocerebellar angle, then tentorium. They are benign. Here is MRI of brain showing meningioma. This is meningioma. This is MRI and this is CT scan. CT scan shows bony involvement also. This is called bony ulceration. This is meningioma near the optic nerve on the right side. This is meningioma of the cerebellopontine angle. This is MRI contrast of the same patient showing meningioma of the cerebellopontine angle. Then tumors of the sellar region. The most important is adenoma. Adenomas are microadenomas or macroadenomas. The most common one is prolactinoma, causing secretion of prolactin. That could cause infertility in females or galactorrhea in females. And growth hormone secreting adenomas are also seen that lead to acromegaly. They could cause optic chiasma compression leading to bitemporal hemianopia. This is an MRI of the patient showing macroadenoma of the pituitary. Secondary tumors arising from the lungs or breast or colon are also seen. 25% of the tumors of the brain are secondary. Here is a CT brain of the patient showing metastatic tumor. This is MRI of the brain showing metastatic tumor. There is contrast enhancement of ring type in nature. This is an example of metastatic tumor. How a tumor is diagnosed? Tumor is diagnosed by the history, that is gradually progressive worsening of headache, nausea, vomiting, fits, could be focal or generalized. And when we do fundus examination, we see papilledema. Then we advise the patient with the CT or MRI. CT or MRI will confirm the diagnosis of brain tumors. Then the treatment of brain tumors is number one is surgery, that is classical surgery, in which the part of the brain that is containing the tumor is opened via a hole or craniectomy. Whole of the flap of the skull bone is removed, and then the underlying tumor is also removed. This is the classical surgery of tumor. Then gamma knife surgery is very common these days and has lesser side effects. I will show you the example here. In gamma knife surgery, if for example there is a tumor over here, then radiations are focused from all directions over this tumor, instead of classical radiotherapy, in which whole of the brain is exposed to the radiations from all around, leading to the different side effects, radiation necrosis and other side effects of the radiations. Gamma knife has lesser side effects as compared to the classical radiations. Then chemotherapy, in very few cases of brain tumors, chemotherapy is effective. Then therapy of the raised ICP should be addressed, and symptomatic therapy, for example, if patient had fits, then fits, epilepsy, if epilepsy should be controlled, if patient had headache, vomiting, these symptoms should be addressed. Then the paraneoplastic syndromes. Metastatic tumors are actually in which neoplastic or cancerous cells move from one side of the body and metastasize to the brain. This is example of metastatic tumor. In paraneoplastic syndromes, actually antibodies are formed, that antibodies react to the different parts of the nervous system, leading to different syndromes. For example, all parts of the central nervous system can be affected: central, peripheral, neuromuscular junction, and muscles. The common ones I will show you. Paraneoplastic syndromes arise from small cell lung carcinoma, breast carcinoma, ovarian carcinoma, Hodgkin's lymphomas. The antibodies associated with the paraneoplastic syndromes are anti-Jo, anti-Hu, anti-Re. These antibodies are formed against the primary site that cross-react with the other parts of the nervous system. For example, in central nervous system, the common paraneoplastic syndromes is cerebellar degeneration, limbic encephalitis, opsoclonus, myoclonus syndromes, stiff person syndromes. In peripheral nervous system, paraneoplastic syndromes could lead to Lambert-Eaton syndromes, and sensory neuropathies are commonly seen in our outdoor clinics. Thank you for your listening to this presentation.